Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, in hysterosalpingography, fallopian tube is seen in beaded appearance with clubbing of fimbrial end and ampulla. This is seen in tuberculosis. Beaded like fallopian tube and clubbing of fimbrial end is seen in tuberculosis. A lady approaches to physician for contraceptive device. On examination, two symmetrical ulcers on vulva which were well defined with firm base. Which of the following is most likely cause? Two symmetrical ulcers on vulva which are well defined with firm base is actually chancre, which is for syphilis. Two symmetrical ulcers, well defined firm base, that is chancre, which is due to primary syphilis. Then 25-year-old female with history of multiple contacts presenting growth on the vulva. Vulval growth is mostly condyloma acuminata.
thank you and thank you for watching.